It's all about the relationships between staff and the individual, between staff and families, families and the individual. And we've really learned that it requires all of those people working together as a team to provide safe care and also to provide care that works. One of the things I've learned in this work is I always knew that person-centered or really individualized care was the right thing to do for the individual who lives with dementia and their family. But what I've learned, especially in the last sort of year of doing the work here at Parkview, is that that care that's focused on the relationship is actually all about providing safe care. It provides care that our hands-on care workers are encouraged. If you feel that things are going askew at any point, just take your time. Just if it's safe to do so, just back off, come again. Don't feel like you have to get everything done on somebody's time schedule. It has to be all about what works for you and for the individual you're looking after. Families of people who come to Parkview often have been through a lot of stress in supporting their loved one with this illness and this variant of their illness. They often are very worried that we will not do a really holistic kind of assessment and that we will focus primarily on medications or sedating their loved one. And I think they're very often and most often very grateful after a week or two of getting to know us and we getting to know them and seeing that we're really interested in their goals and their loved ones' goals for quality of life, and people understand much better why, if we do propose some kind of pharmacological intervention, what the rationale is, how we're going to monitor it, and they see that it's much more than that. It's just that's one piece of it.
Position her so that she's not sliding all the time.
Now how will that be for her financially?
I asked some Basil to look into that, just to do some problem solving with me as to...
So the team approach developed at Parkview was unique because it was a program that didn't exist, and the developers of the program were able to say, this is the philosophy that we believe to be the safest and the philosophy that's going to lead us to the best outcomes.
But she couldn't initiate.
Everybody understands that the work is stressful, so we work really hard to be supportive of one another. You have to allow staff to have flexibility. You have to hire the right staff who have a passion, and then you have to nurture that passion. And you have to have an environment that really encourages learning. So all of us learn from each other and then learn from new evidence as it comes along, but it's an environment where people really are encouraged to share what they've come to know. The goal would be to take the learnings around individualizing care, around changing the way we organize people's workflow, around involving families, and doing that early, because if we do a really good job of that early, we probably, in many, many cases, will be able to prevent people's behavioral support needs from becoming so intense. I think the eureka moment is just when you come together around a table and you talk about how the week has gone for someone, and you start to hear those outnumber the things that have challenged them, and then you go, yeah, this is really quite different, and this is really working.